Hi, and welcome to the Kidney Foundation's Kidney Plugged In show. March is Kidney Health Month, and today our show is packed with information you need to know about your kidney health. First, meet Gloria Freeborn from BC Renal. She's here to talk about how BC Renal serves the kidney community and to talk about the kidney health assessment you can do right on the BC Renal website. And we continue with more from our mini documentary series, A Family's Journey Towards Kidney Transplantation. And the Kidney Kids are back with their tips on how you can keep your kidneys healthy. So don't go away. It's all next right here on Kidney Plugged In.
So I have a very special guest in studio with us today, Gloria Freeborn, the Director of Strategic Initiatives and Development with BC Renal. So welcome, Gloria.
Thank you for having me.
So maybe we could start off and just, talk high level about BC Renal and its role, its mandate. I know it's really kind of the driving force of kidney care here in BC, and there's so much that BC Renal does. So maybe you could just give us kind of in a nutshell, what's the role, the mandate?
What do we do?
Who are you?
I like to think of or describe BC Renal as the hub for a network of care providers across the province, so in all the different health authorities around BC. Some of our essential mandate, our essential role is to plan and fund care delivery in the province to ensure that everybody has access to equitable care wherever they might be. We develop standards and guidelines to ensure best practices for kidney patients. We also measure and report both at the patient level and the system level to ensure that we're always improving care and doing what we can and showing evidence that we're improving outcomes for patients and their experience of care. We support research and quality improvement and knowledge translation and education. And we also have, in more recent years, been working to increase public awareness of kidney disease and kidney health promotion.
Well, that's a huge mandate. And one of the things that we do know about BC Renal is that it's received national and international recognition in terms of the model of care that BC Renal provides to patients here in BC. Can you talk a little bit about that?
Sure. I mean, I think foundationally, the key principle for us since we developed in 1997 has been equitable access to care. So the idea that no matter where you are in the province, whether you're in the Lower Mainland, you're up in the north, you're on the island, you have access to the same kinds of services, the same quality of services. So that's been key, and our ability to do that has been our ability to work as a network and with one voice to the Ministry of Health in our planning, to ensure that we have the funding required, to ensure that we have the information systems that will not only drive patient care on a day-to-day basis, but also support improvement over time and our ability to measure and evaluate, what we're doing, is it actually making a difference for people? And if not, let's course correct and do something different. And working as I said, as one big team. So, we have nurses and doctors and dietitians around the province who sit on our provincial committees and help drive some of those standards of practice and guidelines and whatnot, and also help support development of patient materials so that we can provide the education to patients so that they can get more involved in their own care and know how they can best support their own better health outcomes.
Among the many accomplishments that BC Renal has on its list, I know the medication, having access to fully funded medications is something that BC Renal is really a leader in across the country.
Absolutely, and so as I said, when we're talking about working together as one team, as one voice to ensure that all the elements of care are there, and we believe that medications are a big part of that piece. And so we've developed what we call pharmacy formulary. So all the essential medications that we deem to be important for the delivery of care are fully funded. And we're the only jurisdiction in the country that provides that level of support for patients. So they don't have to worry about whether their extended health can provide it, or if they're not able to have an extended health program, that they know that they have access to the medications that they need. And that's a continually evolving world where we have pharmacists and other care team members from around the province who work together to assess and evaluate what medications are essential. And we can actually, through our provincial database, which I mentioned earlier, we can actually evaluate the efficacy of those medications and make changes as we go. So that's certainly one of the things that we're most proud of.
Let's see, so kidney is a... These are my grandpa's kidney stones. They're very precious. Kidney is a bone in your back that helps you turn. I don't know, to be honest.
They don't know kidneys are vital, do you? Get the facts at kidney.ca.
In 2012, when she was as ill as she was, we were told that she would be put on the transplant list. And so at that time, myself, her father, her aunt on my side, and her father's brother were all tested. And at that time, unfortunately, all three of them were ruled out due to previous and current health concerns. And at that time, I only went through the process of filling out the questionnaire and giving my blood. But at that time, I was deemed at that point to be her match. Now, there are a number of steps. There's about 7 steps in the donor process. So now that we're faced with that again, I just started on that journey. I contacted the transplant nurse coordinator at St. Paul's, and as I understand it, they're known as the Transplant Hospital in Vancouver. And I believe you can also go through VGH or Vancouver General Hospital. I was recommended to St. Paul's. I contacted her. She emailed me over the package to be a donor. And so there's all sorts of things to it. Getting the blood work is the easy part. Filling out the questionnaire and answering for yourself and for them, you know, kind of who you are and why you want to do it. And then from there, there's a number of tests further to that, as non-invasive as psychiatry, sitting down with and talking to somebody so that mentally you're possibly prepared for it, as well as physically. So the process of going and getting ultrasounds and CAT scans in regards to making sure your kidney function is at an optimum level for it to be transplanted to Eva. So, and things I've learned along this journey at this very initial stage, reading all of the paperwork even last weekend, is that you have to be 19 to donate. They told us that Eva is a type O blood type and that the donor has to be a type O blood type. So she can, as a type O, you can give to any of the blood types, but you can only take what you are. So we'll go down that journey as to seeing if I continue to be the same match that I was in 2012.
Feed them a healthy diet. Eat foods rich in vegetables, fruit, nuts, and 1% milk products, and food low in sodium and saturated fat. This eating plan can also lower your blood pressure. I'm Brahman from Plugged In.
One of the other points I wanted to touch on too is the focus that you've had on early detection and the prevention piece. And we were talking earlier about the number of how it's brought down over year after year, the growth in number of patients on dialysis. Mm-hmm. So do you want to talk just a little bit about where we are at with that today? Because you were mentioning sort of a very high number, 16% or something years ago, and where it sits now.
Yeah, when before we developed the BC Renal Agency, we were at about 16% growth a year. So every year there was an additional 16% of patients who were requiring life support dialysis services. And through our early intervention, through our provincial lab strategy to ensure that we have standardized testing for kidney function across the province, a standardized understanding amongst physicians, and referral processes to nephrologists and to kidney care teams. We've set up provincial clinics around the province so that people have access to a full team that can support them with their kidney disease. We've been able to reduce that growth from, like I said, about 16% to, it varies, but it's probably about 3 to 5% per year. So that's a huge impact on patients' lives. If you can maintain your kidney function and not require dialysis to stay alive or a transplant, huge impact on quality of life, on your day-to-day experience, and your lifespan, basically.
So BC Renal has a wealth of resources online that I think would be of real interest to kidney patients, to caregivers, to anyone that's in the kidney network. You mentioned that there are a number of video resources through your YouTube channel. Can you talk about that?
Yeah, so over time, many of our materials are print materials, but we also have a whole host of videos that people can access through our YouTube channel. So if you go to YouTube and then look for BC Renal agency, then you can find a bunch of materials. We have step-by-step training videos for peritoneal dialysis. We have a whole host of what's called modality options videos. So it takes people through each of the types of treatments for kidney disease, and especially for people who are at the point of making a decision about dialysis care, it's actually really helpful. It includes interviews with patients and can really help guide people through their decision-making process as they go.
What I love when, Gloria, as you've talked about this, I just envision, the patients in the center of this hub, and all around them are, experts in their areas that are helping the patient, empowering the patient along their journey here.
It's funny you should say that, because I've been with the renal agency now for quite a few years, more probably longer than I want to admit. But when we developed our organizational structure document, it was very different for the time. So the patients were literally at the center of the chart, and then we had they live in their health authority, so they live somewhere geographically, and then we have the renal agency around that, and then of course all the other structures, the PHSA, the ministry, and other structures that are ultimately to support the patient. So the focus is always on the patient, and everything that we do, is it in the best interest of the patient, and if not, how are we going to shift that so that we can make that the case.
And I think, so much of what we've talked about today, the tools, the resources, again, all to help empower the patient along their journey, so that they're feeling that they're part of this, and they've got some of the knowledge and expertise even to have those discussions with their healthcare provider.
Absolutely, yeah, for sure.
Gloria, this is so great. I've got more questions though that I want to ask you. So I want to come back in just a few minutes. Will you hang tight with us?
Absolutely, yes.
Great. Stay tuned.
Keep them fit and active. Take them out for a walk or a run. Aim for 30 minutes 5 times a week. This will help maintain a healthy weight, which can help control both blood sugar and blood pressure. I'm Sophie for Plugged In.
During the donor process, it starts with the initial blood draw, and so what they do is they do a cross match of tissue and blood, and I may be the donor at that point, but then there's so many more steps that need to happen, and they may uncover at that time that my kidney, one of the 2 kidneys, is not the best match for Ava. Or they may uncover an undiagnosed health problem, and those are the things that could preclude me from being her donor. I had my blood drawn yesterday. I'll be emailing the questionnaire to the nurse coordinator today, and then we'll see, based on hopefully those matches, we'll see what they come back and say, okay, what we'd like you to do is this appointment with this division, and we go through that process. And they may stop it at any point, or they may say, okay, and then the next appointment is.
Here at BC Children's, heading into kidney clinic, and that includes social work, dietitian, pharmacist, and of course the doctor.
I can kind of hope that it will be me. There'll be some changes in my life that will have to happen before and during and after. But if I am able to give that gift to Ava, well, won't that be great? But again, there's no promise.
Reduce their salt intake. The recommended sodium intake for adults is not more than a teaspoon a day. Try to limit the amount of processed food or don't add salt to your food. Your kidneys will love you for trying your best. I'm Kaylana for Plugged In.
So we're back with Gloria, and we're going to talk about the kidney health self-assessment. And I think the key word here that you wanted to bring up is health.
Yes, so I think we really want to focus in on promoting kidney health. How can people ensure that they're supporting their own kidney health, that they're aware if they're at risk, and if they are at risk, how they can ensure that they maintain their kidney health over time, as opposed to being disease-focused. Our system has often been really disease-focused and treating disease. We want to really focus in on raising awareness and ensuring that people can support their own health.
And that brings me to another point, because another tool that BC Renal has produced, and I think this is a really good tool, it's called the Kidney Health Self-Assessment.
Yes.
Again, we'll put that information on screen. Yep. But this is a test I think you would encourage everybody to go and do.
Absolutely.
It's pretty simple.
Yes, it's quick and easy. It's 9 questions.
9 questions.
And we're talking literally yes, no. Do you have diabetes? Yes, no. Do you have high blood pressure, and are you being treated for it? Yes, no. So it's 9 simple questions, and at the end you get a readout that basically tells you either looks like you're in good shape, that you don't have to be too concerned about kidney disease, or next time you're in to see your GP, maybe just ask, should I have my kidney function tested? Or, you really should make an appointment, call your GP, and let's get this evaluated. And it's a simple blood test. It's called an EGFR, and it just evaluates where your kidney function is at in terms of a percentage level, and then you can make decisions based on that. So if you have that test done and it's found that maybe your function isn't as high as it should be, there can be some additional tests done. And as I said, for those patients who ultimately are diagnosed, there's a whole system of care for them. And the earlier we can identify those people, and the earlier they can get into the system of care, the better their health outcomes.
And help them to manage through, lifestyle factors. And I think
that's much more impactful early on. If you make dietary changes or some medication changes early on,
you can maybe
huge impact.
Hold your kidney function numbers for
Whereas
quite a
if you're
while.
coming in at the end and your kidney function is already low, it's harder to recover from that.
Well, it's 2 minutes, roughly, give or take. 9 questions, and it really does, while it's not a diagnostic tool, it is a really good self-assessment, giving people some good information in terms of, directing them to where maybe they want to go next. And albeit to go visit their doctor and request. We always say request the test. Yeah. Kidney test, if you can't remember it, but it's called technically the
EGFR, which is a function of, we won't get into the technicalities of it, but it's very quick and easy. And I'll say also, as you do the assessment, it is quick and easy, but you can also take a bit more time throughout. There's little pop-ups, and you can learn more about, for example, with diabetes, why is diabetes a factor, high blood pressure. You can sort of learn a little bit more about those aspects of that influence kidney disease as you go through the test, or you can just quickly bomb through and answer the questions and determine what your next step needs to be.
So one thing we should mention about the kidney health assessment and encouraging people to go and take it is that you're running a special contest during Kidney Health Month.
Right. So throughout the month of March, everybody who completes the kidney health assessment, which is, as Deb mentioned, is quick and easy, 2 minutes, they can enter to win an Apple Watch. So at the end of the month, it's voluntary. At the end of the assessment, if you'd like to enter, you can enter in, and at the end of the month, we'll pick the winner for that. So that's
pretty cool.
Yeah,
that's a nice
yep,
prize.
Absolutely. So I don't have a kidney. I don't have an Apple Watch,
one of those
so,
either. So there you go. Don't miss that. During the month of March, you have the chance to win an Apple Watch if you go fill out the kidney health self-assessment. So thanks, Gloria, for that.
Please don't smoke. Kidneys hate smoke. It slows the flow of blood through them, impairs their ability to function, and ruins all their fun. I'm Bronwyn from Plugged In.
Finding a donor is a very interesting process. I spent a whole day last weekend watching videos and reading all the videos that were on the BC Transplant site and reading all sorts of pamphlets and information on how to go about asking friends and family to consider being organ donors. The interesting part is that being born in Los Angeles, a lot of my family and friends are American, and I understand the process is to have anybody within Canada be tested as a match first, and then they will look at anybody from another country, such as the US, as to whether it would be a match. So providing a letter, I've kind of morphed some personal aspects of her life and my life and Rich's life into it, so that it speaks to our family and friends, for them to even consider being a living donor and going through the testing themselves. They might, through that process, decide this is something I want to do. They might, get halfway through the process and go, oh, this is something I don't want to do. That's completely their personal choice. During the process of choosing to be a living donor, at any point, I know that the medical team will touch base with them to ensure that that is their decision at each point, even literally to the day of the operation. Are you sure? Are you sure that this is what you want to do? And there have been instances when people have gone through the process and have chosen at the last minute, I'm not built for this. And so that's when it comes down to that personal decision.
So Gloria, we were talking earlier in terms of activities going on during Kidney Health Month. You brought up kind of a fun one, something called the Kidney Health Challenge. Can you talk a little bit about that?
Absolutely. So throughout the month of March on our social media channels, we're promoting the Kidney Health Challenge. So every day, if you follow us on Facebook or Twitter, you get a very simple and easy kidney health tip. So something you can do to support your kidney health. So whether it's drinking water, there's some tips around stress reduction, exercise, etc. So some dietary tips as well. So we encourage everybody to take part in the Kidney Health Challenge. So you have 31 opportunities to support your kidney health throughout the month.
Oh, that's fun. Now, if somebody happens to miss them on social media, is there somewhere else that they can go and
find
absolutely.
Yeah, on our website, we actually have a Kidney Health Challenge booklet, and there's two options. There's sort of the quick and easy calendar view, and then there's a booklet that actually has additional information about each of the tips and why they're supportive of kidney health.
You guys have thought of everything. So that's been a wealth of information. Thank you so much, Gloria, for coming in today.
Well, thank you for having me.
Can you imagine losing most of something without realizing it? Over time, kidney disease can destroy up to 80% of kidney function before you notice any symptoms. Talk to your family doctor to see if you're at risk and need to be screened. It could save your life.
As Ava's journey continues, so will mine as a living organ donor. And so as that process happens, appointments hopefully will happen. And as I get the word out, then other people will contact the nurse coordinator at St. Paul's Hospital in Vancouver, and they will go through that process themselves. It's all anonymous, and so as they're talking to the doctors and being tested and talking to the nurse coordinator, it's something that Ava, our father, or myself have no idea that's going on. So in the end, we'll find out who has stepped forward and chosen to give that gift of life and how they match up. Ava's scared to have me or anybody close to her as her donor because what if something happened? And if something happened, if she deems me as one of her strong pillars, is what if that pillar's weakened, and what if I'm going through that process, but I expect that my strong pillar will be there, and if my strong pillar's not there, then I'm weaker. It's hard enough that she's going through this process, and then as good as it is for her to be along this journey with me, how scary it is for her to have the worry about herself and the worry about me.
Reverse donkey. Donkey going halfway.
As much as you can tease your mom, you don't want your mom hurt, or your father for that matter. And there's nothing that a parent, a mother or father wouldn't do for their children. And so if this is my way of physically protecting her, then I would, as would her father, go to the ends of the earth to do that. So we'll just have to see what the next steps of this journey holds, and we'll take them all together.
Thanks to all the car donations made to the Kidney Car program, the Kidney Foundation of Canada can help all these people with kidney disease. Those donations are instrumental in providing them with care and invaluable support. When you give your car to the Kidney Car program, it will be towed for free and recycled or resold. You'll also receive a tax receipt of at least $300. To continue to improve the quality of life of thousands of patients, we need your car today.